Hi, I'm Dr. Sarah Wasserbauer. I want to talk to everyone today about photobiomodulation, something that if you're interested in hair, you definitely need to know about because this is a treatment that is going to be something that you will use on your patients in the future to get them to grow hair, prevent hair loss, and maybe recover from a big shedding event or something like that. Something that definitely works with other hair loss treatments, but that it's really misunderstood. So you might not know a ton about this particular modulation called photobiomodulation. So here's the skinny on it. Let me share my screen. All right, photobiomodulation. So photobiomodulation is often misunderstood. There's a lot of hype about it. A lot of people who've been doing this wrong forever, and so you see it in in-flight magazines and you kind of wonder, is this something that really works or is it just a gimmick? Well, for the longest time, I thought it was a gimmick too, until I started to drill down and figure out what exactly it was that worked with photobiomodulation. I don't have any conflict of interest. Nobody's paying me to promote a product currently. Hopefully somebody will come forward. Um, and so because it is so misunderstood, there's a lot of people who want to know whether it causes hair growth, whether light stimulation actually causes hair growth. Probably about half of you out there wish it worked better so that you can recommend it to your patients. And maybe you've seen some improvement, but you haven't seen a ton. And then probably the other half of you out there are thinking, this is just snake oil. I got this great picture from when I was in Dubai of snake oil on a regular old shelf. I mean, it was right next to snake oil for a couple of other things, but this one was for hair. And the problem is that when you deal with biological tissues, getting the evidence, particularly for hair growth, because it takes so long for head hair to grow, takes a while. Now, it's probably not something that you're going to be able to find equivalencies with other hair loss treatments like minoxidil or finasteride, because low level light therapy is not necessarily something that you can patent in the way that it works. And a lot of people just believe it's too good to be true. So they put it on the shelf right up there with this snake oil. But you could probably actually take a second look. What is photobiomodulation? I mean, we'll just start with the basics here because we know that light affects tissue, right? All you have to think of is like your vision or vitamin D affecting, because vitamin D is a hormone and you manufacture that when you go out into the light. You talk about tanning, the fact that your body will get a sunburn if you, expose yourself to too much light. Seasonal affective disorder, having lower levels of light, which of course affect our circadian rhythms, but also affect our mood and our brain function. So all of these things we know of and we completely accept that light affects these tissues. But when it comes to hair, there's a little bit more nuance. And let's go into what that nuance is. So let's talk about the first law of photobiomodulation. So we've known since the 1960s that photobiomodulation works. There's a guy named Andre Mester. He's called the father of photobiomodulation. In the 1960s, he was using red light of a certain wavelength to see what effect it had on the tissues of mice. And he had, shaved the backs of these mice, and he wanted to see what effect the light had. And what he noticed was that not only does the wounds that he put on the backs of these mice heal faster, but also that the hair regrew faster too. You can go online and look up his original articles, 1966, 1977. And he's the guy who coined the term photobiomodulation and did the early work on light and, effects on tissue. So in order for light to affect tissue, I'll just move myself down here, the accepting tissue has to have a photoreceptor. It has to have a molecule. Usually it's a chromophore, a photoacceptor to allow the change to happen. So you have to have something that absorbs the photon, and it's usually tuned very precisely to the wavelength of that photon to have a biologic response. And in the case of hair, this is probably cytochrome C oxidase, which I know you've heard of. It's a mitochondrial enzyme. It regulates oxidative phosphorylation, so it turns things on and off. And this particular enzyme is actually upregulated by treatment with 670 nanometer light. We still don't know what exactly that light is, whether that is the perfect wavelength to target cytochrome C oxidase. Probably it's within a certain range. And at the outskirts of the range, it doesn't work as well, but there's probably a very specific target wavelength within just a few nanometers that works better than the outline. But within that range, the light will have an effect. And so this is a plant cell, but you kind of get the idea that light comes in. Some of the light, of course, gets reflected. I'll go into this later. But the light that gets absorbed and gets absorbed in the right wavelength, that's why they have the little rainbow there, will actually trigger the biologic response that you're looking for, okay? And of course, this is a chromoplast, and some of the light gets transmitted, so you can't, unfortunately, use that to get your effect. But then what happens within a hair follicle when light is hitting hair, okay? Well, light within a specific wavelength does grow hair, as we said. And the reason I have the little asterisk above here is because we're talking about Andre Master. So we know for darn sure that it actually lowers inflammation and speeds healing. It probably speeds healing through the action of the photon actually warming the tissue and vasodilating the little blood vessels that are feeding the hair follicle, okay? We also know that it promotes the release of growth factors. Multiple growth factors have been implicated in this particular technology. We also know that it upregulates the transcription of ATP. So the energy production for the hair follicle to enable it to give something to grow. Growth of hair is actually a hugely energy intensive action of the body. It's one of the things that consumes a huge amount of calories, and relative to, you know, the things like hearts, lungs, and brain function, you'd think that it would be kind of a sideline. But in actuality, it takes a lot of energy for your body to generate hair. There's a great TED talk on this by a guy named Tom Dawson that you should check out, because it goes through the amount of energy and how much effort your body puts into growing hair. So it's not just a trivial object. And like I said, it also increases blood flow. And here's some of the data that we know. I'll make myself small here. Some of the data that we know that proves that low-level light therapy actually does. I'm going to say photobiomodulation because in 2017, the ASLMS came out with a position statement that we should be calling it photobiomodulation. So when you do your search terms in PubMed or whatever, you know, Ovid, whatever medical database you're looking through, look up either photobiomodulation, PBM, or PBMT, and you'll find articles like this. And I'll just summarize a couple for you. This one was from, let's see, 2013, low-level light therapy for androgenetic alopecia. This is a nice 24-week double-blind sham-controlled multi-centered trial. And it showed increase in hair counts and mean hair diameter at 24 weeks. I would love it if somebody would do something that was longer than 6 months, because we know it's going to really take a full year. But of course, everyone wants their results soon. Their device had stationary sources. This is something that's probably very important from a physics perspective into making light work for hair growth. Rotating light sources don't penetrate enough, and I'll show you this why later. But here they had their fluence at about 48 joules per square centimeter. So their power density, their number of joules per square centimeter, is how you're going to be measuring the amount of light and the dose that you're giving with this therapy. Here's another one. The growth of human scalp hair mediated by visible red light. Of course, this was just in males. This is another one from 2013. 35% increase in hair counts at 16 weeks. And that's just 4 months. Of course, they probably didn't get the physical sensation of feeling additional hair. Those patients probably didn't get that. But hair counts are a good way to be able to tell whether or not their hair devices are working. And again, they had a mix of both LEDs and lasers. Their fluence was at 67 joules per square centimeter. Here's some more. Low-level laser therapy and hair regrowth, another evidence-based review. I've got the link right here. This was kind of more, this was 2015 or 2016, kind of more of a sampling of all the different data that had been collected. And here's another meta-analysis of using low-level light therapy, again, photobiomodulation, for treating alopecia, hair loss, hair shedding. It might even be useful in just reducing inflammation in the inflammatory, the cicatricial conditions that cause hair loss. So if this is the evidence that we have, and there's a lot more than that, believe me, but if this is the evidence that we have that this works, what's the problem then? I mean, there's actually a lot of problems. Unfortunately, I have to distill it down to just a certain amount of time, and you don't have, all day to sit here and listen to me talk. So here's my top 10 list of the current problems of using photobiomodulation for hair growth. Okay. Here we go. Number one. Problem number one is the optical window. A lot of these have to do with physics. You got to go back to what your old physics professor used to tell you. So different wavelengths affect different tissues. And so for hair, you have to, especially hair follicles in the scalp, because the body hair follicles might be different. You have an optical window of about 668 to 684. Okay. Now there's some evidence for other wavelengths, 830, 810, 400, in the 400 range, 430, those come to mind. Okay. And here's a graph just showing the different wavelengths. Dense connective tissue absorbs best, here. Muscle is going to absorb here. Loose connective tissue is going to absorb here. So you can see that there's going to be different wavelengths that affect tissue differently. And when we're looking at hair, we're mostly looking at kind of skin, maybe some dense connective tissue. But the optical windows, oh, that went backwards. The optical windows are going to be different for each tissue. So we don't know the optical wavelength. It's probably somewhere in here, 668, right in there, somewhere up to 684, probably right in here. Okay. You're mostly made of water. They're looking at, water absorption in your tissues. And they also look at melanin absorption. Now, if you've got, darker pigmentation, light isn't going to penetrate as well. It'll be absorbed or reflected. So we don't know the optical wavelength yet. And even more confusingly, it might be different for each patient. How frustrating is that? So 668 to 684, we've got 813 to 846, like I said, about 830 range, 453. Some recent data has come out with that. Problem number two is the therapeutic window. So the Arndt-Schultz law is the window that shows that too little isn't going to have an effect. Might as well just leave your therapeutic helmet on the shelf. But too much also has an inhibitory effect. So the interaction is dose dependent, and more is better, only up to a point. Because once you reach this level here, you're going to be decreasing your effect. It's going to be inhibitory, and you're going to have a negative effect. What you want is the stimulatory effect, right? So this is the Arndt-Schultz law. It's definitely targeted more towards healing tissues, but higher doses are inhibitory, and that's the takeaway from this. This is the other part of the therapeutic window. Interaction is dose dependent up to a point, and each dose builds on the previous treatment. So too much gets up to inhibitory territory, and you have to think that these treatments are stacking one on top of each other. This would be, this, you see how this is the effect that it's having. Well, if you start the next one, at 2 or 3 days after, that's perfect. It's gonna allow it some decay time to have its effect on the tissues. Some people posit this probably takes 24 hours for it to really stimulate all the cycles to actually get into gear. Well, but if you do that too much, then you end up with these stimulating effects, making it into the suppressive effect territory. Okay. So this is not enough. We haven't gotten into the little thread the needle territory. And this is too much, where you're going way past the needle, and it's not going to make it anywhere. So too much is inhibitory. And cell proliferation, hold on, and growth of hair is optimized by low doses over longer periods of time. So I'll go more into this later, but this is going to be like brushing your teeth or a little bit of exercise every day. You're going to want to do a little bit all the time. No weekend warriors here. This is going to be something that you do as a medical treatment over time. Problems number 3 through 6 are all physics. So let's talk about these one at a time. Number 3, inverse square law. That's this guy right here. So, and I think I have these on. Yeah, this guy right here. So the distance from the light source is going to double. When you double the distance from the light source, you 1/4 the amount of light that's getting to the intensity of light that's getting to your target source. So the more distant you have it from the scalp, remember it has to get into the scalp to affect the hair follicle. It can't be way up here. The more distant you have from the scalp, the less light intensity is going to get to your target. The next one is Lambert's cosine law. So that's this one. Lambert's cosine law means that if you are actually hitting your target perpendicularly, you're getting the most amount in, 100%. But anytime you vary off of that perpendicular approach, light is going to glance off and you're not going to get the dose of light that you want to the tissues. So if you're coming in at an oblique angle, you can't do it. Well, that's a problem because the head is a curved surface. So it's kind of like trying to wrap a shag carpet around a basketball. Everything is going to radiate out. So you need to have radial targeting towards your head surface. And remember, not everybody's head is a perfect circle either. Everything kind of has bumps and, nodules. And if you've ever seen a shaved head, there's a lot of variation there. The next one is the bleaching effect. So it's going to take between 14 and 20 minutes to penetrate to the depth of the hair follicle within the skin. This is from text by Lars Hode. Lars Hode, Hode. And that shows that the light just doesn't flash on and reach all the parts that it needs to immediately. There's a physical principle called the bleaching effect, which means you have to actually give it some time to make its effect. And then the last one on this list is number 6, lasers versus LED. So initially, lasers were used to try and get through hair. You can see in my hair, I'm wearing a ponytail today. If you can see this little bit here, the light is going to get to that little bit. But that's why they use lasers, is to try and make it as straight and get it into in between the hairs as possible. And some laser devices actually used different things like hair comb to part the hair. They suggested getting it wet, combing the hair so that the light can get in between your nice fluffy hair to get down to its target. Once the light is at its target, once it's actually penetrated into the surface, doesn't matter. The light becomes incoherent. And there's 2 types of light. One is the straight, that's coherent light, that's laser light, that goes straight in the direction that you want it. All the energy heads that direction. Another one is incoherent, kind of like this light bulb right here, kind of goes out in all directions. And a lot of that light gets scattered and reflected and absorbed. So what you want if you're distant from your target is laser light. And so that's why a lot of hair lasers were developed, because a simple, scattered light, an incoherent source of light, the same thing, won't get it to your target. But once it's actually in the tissue, then it matters as well. But it doesn't matter whether it's laser light or whether it's LED, as long as you get it to the tissue. It's just getting it to the tissue that mattered. So once you get it into the tissue, then we go on to problem number 7. And that is that distant light. Well, let's say you got a bald person, you're able to get the light to the tissue without having to worry about actually setting it on the tissue. Creates a different cone of influence than a light source that's actually on the surface. And these are the 2, differences here. So if you have a distant source, obviously more light's going to be reflected, but it actually creates sorry, I didn't mean to do that. It actually creates a different cone of influence. You see, wide and flat. This isn't going to get as deep as you need to in order to have the effect that you want. So it must be on the surface. Now, if it's on the surface, you can see that it actually gets much deeper and it will be distributed into the tissues instead of that wide, flat kind of canoe of influence. It's going to be more like an egg. It has the depth to get to the level of the tissue where you're trying to have the effect where the cytochrome C oxidase is actually, helping the mitochondria to oxidatively phosphorylate. Okay. So the other problem with having a light source that's distant from the tissue, it's going to be scattered, reflected, and the hair gets in the way. Once it grows the hair gets in the way. Anyway, here's the next one. Patient hair length. I'm feeding right into my own points here. So hair length significantly affects light dosing. As little as 2 millimeters is going to reduce the absorption by 32 to 37%. And I didn't even come up with these numbers. So we've tried to get around this by parting the hair or wetting the hair, like I said, and also by using lasers, because they can kind of make it through the hair with a minimum of scatter. But once the light is in your scalp, it kind of doesn't matter. But what you need to get there is to shave your head. Who wants to grow hair is going to shave their head in order to get hair? The whole point is to grow some hair, not to shave it off. So you're stuck. That patient hair length is going to inhibit the very process you want to promote. So you're going to be stuck in that respect. Now, if you have lighter hair, this is going to be helpful. So if you have, this is I forget who that guy is. He's David Beckham. So if you've got light or blonde hair and you wear it very short, this is going to be way better. If you've got long, dark hair, that's the main problem, because a darker pigment is going to absorb more. And you're going to end up with the problem of not being able to get the light to its target. So it can't penetrate to where the chromophores are if it's absorbing all of the light. You got to think of it like you're taking an aspirin. Well, you want your stomach to absorb that. If you just kind of, rub it on the surface of your skin, it's not going to get to its target. All right. Problem number 10 is dosing. This is kind of a big deal for those people who are really trying to make a good device to target hair. What dose do you use? So once again, with an aspirin, 81 milligrams of aspirin a day is really going to help you with your cardiac prevention. But if you're having some pain, 81 milligrams might be, like my old teacher used to say, pissing in the wind. So what you really want is something that has a higher dose, right? But there's an optimal dose for hair. Remember, too much is inhibitory, too little is not going to be effective. So the optimal dosing would be in the correct wavelength. It's going to be of a longer duration, more frequent, a couple times a week, every other day, between 14 and 20 minutes. And it's going to be probably in the 20 to 30 joules per square centimeter territory. So once again, this is a graph of where some common laser caps are on the market today. The photo energy per treatment is, once again, joules per square centimeter. This is also known as power density. And this is where most of the things are hanging out. Laser Cap 300 is over here. I'm not paid by any of these companies. The Capillus is down here. Theradome's down here. iGrow, Irostor. A lot of these are proliferated. They're all made by the same companies in China and distributed, and people slap their names on them. So the optimal dosing is going to be the correct wavelength, and it's probably going to be somewhere in here. Somewhere right here. It might be different for different individuals, okay? So right now we're just looking at the skin types Fitzpatrick 1 through 4. Just to simplify matters until we kind of get a grasp on what exactly might be going on. And it's going to be probably a little bit higher in joules per square centimeter than what we've achieved so far in our dosing requirements. Now, part of this is due to the way that the first devices came to the market and FDA clearance for those devices. There's something called the 510K, which is an FDA pathway to get clearance for your medical device. Basically, what you have to do in that is you have to ape all the previous devices and show that you're substantially equivalent, which is what people have done in order to avoid, paying for huge medical trials and getting, a longer time through the FDA. They want to get through the FDA process. But that doesn't mean that their device is any more effective. So that's another part of the problem. So optimal dosing is not yet achieved. One of these days it will be, though. And here's my big blow up of this, because you can read all about it. This is a guy from Michael Rabin. Him and this Michael Hamblin are two experts in the field, along with a couple of other people that I mentioned, Lars Hody, Bob Haber over at the Cleveland Clinic. So a lot of these will have, a lot of these people will have discussions about what is the optimal dose, but nothing quite yet exists on the market yet. So The optimal device does not yet exist. You can use photobiomodulation right now with confidence that there's science to support it, but you're probably not getting the optimal dosing. That will come. It will definitely help with wound healing if you're a hair surgeon, or if something else is going on with your head. It definitely helps with wound healing post-operatively. In my practice, I get a lot of patients with cicatricial or scarring alopecias. That definitely helps to reduce the inflammation of those. I've seen massive improvements. This is just clinical data, or that's just in my own practice and what my experience is. But within a week, within 2 or 3 treatments, patients have a lot of reduction in their symptoms, itching, burning, the hair shedding. It definitely helps with that. Photobiomodulation will definitely grow or maintain hair, and this is the data that we have. If your wavelength is within 668 to 684, that's where we have the most data, but probably 813 to 864, or pardon me, 846 is possible. And again, the 413 that we talked about before, or is it 453? Sorry, 453. You're probably gonna have to use it frequently. Put it by your bedside. Put it in your car. If you're in the Bay Area, you're gonna be commuting somewhere for 20 to 30 minutes anyway, or maybe not during COVID, but post. And you're looking for a power density in the 5 to 7 milliwatt range. Okay. The best patients seem to be those whose hair loss is early. We do see that with almost all of our medical treatments for hair loss, which this would count one of the medical treatments for hair loss. And it's dose dependent, so more is better up to a point. We don't know what that point is. You definitely want to avoid heat producing elements, especially if you're using lasers, because that will degrade the efficiency of the laser, and you won't be getting the same dose output at 5 minutes as you did at time 0. It sounds like somebody is calling. And there's one other thing to let you know, and that is that photobiomodulation is wonderful because it does seem to act in conjunction with anything else that you're doing. So if you're using minoxidil, finasteride, if you're using even microneedling or a hair transplant, all of those topical therapies that are out there, all of the vitamin-based therapies, photobiomodulation seems to work multiplicatively with all of these treatments. I even have evidence that it helps with our injectables therapies like platelet-rich plasma. And this is from my own data that I carefully calculate on each patient in my own practice. So I know that in conjunction, all of these things can work. So keep photobiomodulation in your back pocket. If a patient has it, encourage them to use it within these parameters. And if they're looking for a device, steer them towards a device that has these parameters. And hopefully we can get photobiomodulation as a bigger part of our armamentarium sometime really soon. I hope that helps. Have a great day.